Welcome back to the morning show here on Arise News. 7 days ago, the Ebola virus crossed the Democratic Republic of Congo's border into Uganda, causing many Nigerians to panic about the possible spread of the virus across the continent. On Sunday, the Nigeria Center for Disease Control, NCDC, assured Nigerians, however, that chances of the Ebola virus being imported from Uganda or the DRC into Nigeria is low, as there are no direct routes from those countries. Joining us now to speak on the agency's risk assessment is the Deputy Director of Prevention and Program Coordination, Dr. Emmanuel Agogo. Dr. Agogo, welcome to the morning show.
Good morning, sir.
Good morning, Dr. Agogo.
Good morning. It's a pleasure to be here.
Yes. When the Center for Disease Control says the risk of importation to Nigeria is very low, how exactly do you mean? Because, the other time it was, from Liberia that we had an Ebola virus crisis in Nigeria. Many Nigerians will think, well, DRC and Uganda are not that far away, and there are probably persons coming from that part of Africa, maybe for conference or any other activity. But your agency insists that the risk is very low. How do you mean?
Yes, the risk assessment what was done was based on several factors. It includes an understanding of the disease, the way it spreads, and the current interventions that are in place in those countries. You may be aware that the World Health Organization as well did an assessment of the outbreak in Congo last week, and there's an assessment which determines whether or not an outbreak is considered a public health incident of international concern. And the World Health Organization's top experts in Geneva decided that despite the fact that a case has spread into Kenya, that it's still not what is called a FEC, there's public health incidents of international concern. On the Nigerian level, we have used this guidance to do the assessment and also looked at our country's preparedness, and also looked in detail in terms of the demographics of the patients who have been affected and the patients who crossed into Kenya. The details of that case was actually a family of a deceased individual in Congo who went across the border back to their family. Part of the family was from Kenya, part of the family was from Congo. They went to take care of a family member in Congo and returned to Kenya. And unfortunately, one of the caregivers and her sons fell ill, as well as some of the family. And so that demographic kind of indicates that for now, the risk is still fairly low when you think about Nigeria.
Now, Dr. Agogo, I believe that the NCDC has also put together a first responders team ready to deploy in 24 hours in the case of any alert or any emergency per se. And you've also put in major units in public hubs such as airports, etc. Do correct me if I'm wrong. Now, I wanted to ask about the capacity of the NCDC and whether you believe that the NCDC has the capacity to contain a potential Ebola risk to the country, or threat, rather.
So preparedness, I like to say that preparedness is the team sport. That means that one individual, one organization isn't responsible only. It's not capable to protect the country. So there's a team of people. We were working with partners, not just the NCDC. We've got the port health authorities who man the ports and who have. There's been escalation and increased alertness in terms of ensuring that the screened passengers who are coming into the country for fever. On the preparedness side, we've looked also at looking at the lab capacity to make sure we can diagnose. There's been widespread training of individuals across the country in the context of Lassa fever, it's a condition that is also one of a viral hemorrhagic fever. There's been a lot of effort also around improving knowledge of infection prevention and control, which is ensuring that at the health facilities that people are more aware of how health workers are more aware of how they can protect themselves and how to deal with patients that might have symptoms that are suggestive of Ebola or Lassa, as the case may be. Another real important aspect is the idea about risk communication. So the capacity has been built over the years to understand risk and to communicate risk effectively to the population so that we don't have undue panic and so that people know what to do, when to do it. And finally, I think the other very important thing is a strong government leadership that we have had. The establishment of the NCDC as an agency also provides an organization that provides a coordination mechanism under the leadership of the Ministry of Health, where threats like this to the country can be addressed.
Yes, Dr. Agogo, I like the point you made about not trying to create panic. But at the same time, in 2014, the major part of the effort to combat the Ebola virus in Nigeria was public enlightenment. People were told, don't do this, don't do that, be careful with dead wild animals, use sanitizer and all that. How much effort is your agency putting into public enlightenment this time around?
Well, a lot of public enlightenment has gone into, I talked about Lassa fever, which is a viral hemorrhagic fever. And the principles that you actually have, that if you follow with Lassa, are very similar. In fact, identical to what you expect with Ebola. And therefore, even though we have not, even though that they were ramping up the information, especially with this crossover of Ebola into Kenya and into Uganda, and it no longer being an outbreak within one country, as we ramp up this information, we will also be linking in these ideas around what interventions are important to prevent you getting Lassa fever. And similar infectious diseases, as well as Ebola. So it's an ongoing continuum of engagement with the community. And this is so important because if you look at the outbreak in Congo, part of the complexity of the issue there is the fact that the outbreak is in a war-torn conflict zone at the moment, and therefore, and the lack of trust between the community and healthcare workers has been one of the biggest drivers of the outbreak.
Absolutely, sir. Now, you also mentioned risk assessment, and I know that the NCDC has a risk communications technical team. That's a group that you want to use to shed a light on all infectious diseases, actually. It's sort of like a communication plan. So with this risk assessment, can you shed more light on this for the public?
So part of what we are trying to do is to get the public to be aware that the country has done a risk assessment. We've looked at the risks of the country's exposure of a case coming to the country. And more importantly, while we have this risk assessment, it goes beyond that. It still doesn't mean that we should not put in place the necessary interventions where such an incident, where a case were to come into the country. The interventions, like I said earlier, the interventions that we need to put in place start from enlightenment, which is part of what we're doing this morning, talking to you about the fact that this risk assessment was done, and also the fact that because these index cases have crossed from one country to another, it does indicate the fact that it is possible that the outbreak in Congo, not being well controlled, could spread to other countries. Having said that, the interventions that we're going to be put in place going forward will be more, definitely more heightened information to the public, keeping the public up to date in terms of the risks of Ebola, keeping also the country up to date in terms of what is happening in Congo. And we'll be working very closely, not just in the NCDC, but with the international partners who are in country, who are our partners in preparedness. So the WHO, the CDC, the World Bank, the MSF, and so on. All these organizations have been strong partners in our fight against outbreaks in the country. And we will be ensuring that we keep working with these partners in country and out of country to ensure that we keep well prepared and ahead of the curve of anything that will happen.
Dr. Agogo, well, I mean, you talked about partnership, but what is the level of partnership, if there is any, between the NCDC as a federal agency and maybe the state governments? Because you recall that in 2014, the state governments also played a role.
Yes, so I think it's very good that you mentioned that. One of the response of Nigeria to Ebola is still celebrated worldwide as a case of best practice. And the best practice has also been assessed, and people have looked at what are those things, ingredients that constituted that best practice. Strong government leadership, both at the national and state levels, were one of the big factors that helped Nigeria combat Ebola successfully. So the Lagos state government, the River state government, and as well as the federal government at the time did a lot to ensure that they recognized there was a problem, and they stepped up to the plate very quickly. Another thing that happened was what we call a whole of society approach, and where it wasn't just the public sector, but the private sector also stepped in, and we all saw this as a common threat that we'll deal with. And back specifically to the question you've said about state engagement. In every state of the Federation, we have an individual we have the directors of public health, just like you have in the federal government. You also have the state epidemiologist, and therefore these are partners, these are individuals that their capacity have been built over the last few years in terms of creating partnerships to strengthen the country and state level capacity to prevent, detect and respond to disease outbreaks. So there's the ongoing partnership with the federal government through the Ministry of Health and through the NCDC, with the state ministries of health and with the state epidemiologists. And this is the kind of network that we work with.
Now, Dr. Agogo, of course, we cannot ignore the fact that poor education standards across the country as a whole, of course, limit the amount of public enlightenment that an organizational institution like the NCDC can really tap into with the public. Now, before we go on a quick break, sir, I just wanted to pose a question to you with regards to that and exactly how we get into the rural areas where people who do not have access to the media, people who may not necessarily also have that much education to really understand the effects of Ebola. How does an institution like the NCDC play a role in ensuring that these people are at the crux of understanding how to prevent themselves from this high-risk disease?
So thank you very much for that question. We have critical partners who we've been working with to do risk communication activities across the country. One of those is the UNICEF, obviously, and of course the state governments. And then in every state you have a state health education officer. And one of the critical things that I think has changed in terms of how risk communication material is developed is to ensure that you test the material that you develop in communities to make sure that the material that you develop addresses the concerns of the communities and ensures that they understand the information you're providing. And the idea of even understanding health information is not necessarily a function of education or not, because the whole studies have shown that health literacy is not even dependent on how well educated you are. Sometimes it's about the material that is developed, the way it is presented to you, and the way it's communicated. And a critical aspect of communication is around trust. Even if you provide the information, you need to see yourself and show yourself as a trustworthy provider of that information. And therefore, you find that sometimes even fake news gets to rural communities where there's no education through avenues of people who are better trusted. So one of the key things that's happened is to develop a brand of trust around communication that has come out of NCDC over time, and to ensure that we engage with people in a way that they are aware of this information. In terms of engaging more with the rural communities, when information needs to go to communities, we tend to engage more with the state to engage with the rural communities. We're also, within the risk communication mechanisms which you described earlier, we also have the National Orientation Agency who are part of what we call the Technical Working Group for Risk Communication.
Dr. Agogo, I would like to know, what are the special challenges that your agency faces in trying to help ensure health security in Nigeria?
As in any government agency, we always struggle with ensuring that we have the necessary material and human resources to meet these challenges. The establishment of NCDC as an agency by the government in November 2018 was a watershed moment for ensuring that the legal the legal premise for the activities are in place, and so that's been a huge strong point for us. I think the other things are ensuring that the resources are provided from government directly to meet the needs, and that government also supports ensuring that the necessary human capital is available at the facility, in the agency actually to do this. But also importantly is that NCDC cannot do this alone. The wider health system, wider investments in health system, in the Nigerian health system is also important, because the NCDC is more of a coordinator of the response, and you need to have the health system being strong, all the components and building blocks of the health system, including health financing, including health service delivery, including all those components of what we call detection, prevention and response. So ensuring that the surveillance system is working well, that the laboratory systems are well funded and are across all the levels are well funded and are functioning well, that we have the necessary human resources, including epidemiologists. The expected benchmark is one epidemiologist for 200,000 people. We're still way below that threshold, ensuring that investments are made in providing resources at the state level as well, to have state EOCs, and then also finally, making sure that there is continuous strong engagement between government and the NCDC, government agencies like the NCDC, as well as the private sector, to fight a common good, which is to protect the health of Nigerians.
Absolutely, Doctor. Of course, we could not agree more. And now, just as we continue this discussion, even though your assessment is low risk for Ebola coming into Nigeria, what advice would you give to the public right now in terms of protecting oneself and making sure that everyone is still on the lookout? Because, as a matter of fact, of course, it is existing right now.
So there's been a lot of information that has gone out specifically in the context of Lassa fever, which first of all is make sure that if you're unwell, you go to a health facility. If you think you might be at risk, be open about it and tell your doctor if you've traveled abroad, if you've handled dead animals, because remember the reservoir of Lassa, for instance, is our rats, but for Ebola, we know that they're fruit bats. So if you've handled dead fruit bats or some dead material, dead animals, anytime before you fell ill, tell that to the doctor when you go there. Don't self-medicate. Also, when you have a sick individual within the hospital, or you have a sick person at home, institute what they call infection prevention control measures. That means that you need to protect. In taking care of the person, you need to use protective equipment. So at the hospital, make sure that if you think that an individual may be at risk or may be suspected of having something like Lassa or Ebola, use the normal gloves and the personal protective equipment so that that spread doesn't happen from the patient to the healthcare worker. Also, I'd like to say that at the cooperate with colleagues that you see at the port health services when you come into the hospital, when you come into the country, or when you leave the country. They are there for your safety and they are there for your health. So encourage them and make sure that whatever screening that needs to be done, that people who come through, everybody goes through that screening. Unfortunately, in Africa, across the whole of Africa, and that is what has really transpired in this case of exportation of Ebola from Congo to Uganda, our borders are porous, and therefore there's a lot of cross-border activity that we're still doing, and sometimes we've done heightened surveillance at cross-border areas. So communities at the borders, if there's something you've noticed that is untoward, some deaths or some illnesses that you can't understand, the idea will be to contact the NCDC and give us that information.
Well, Dr. Agogo, how often and how regularly does the NCDC issue a public health advisory? I know there is an NCDC advisory on Ebola, but how often do you do this? Whether it's Ebola or something else, do you wait till there is a threat of outbreak, or this is something that you do on a regular basis? And beyond Ebola, what are the other ones, the other issues that you focus on, apart from Lassa fever and Ebola at the moment?
So the NCDC, one of the things that's happened in the last few years since we had a change in leadership in NCDC has been a concerted effort to engage the public. And there's a weekly epidemiological report that is released on the NCDC website. And usually it's also on our Twitter handles and it's also on our social media handles as well. So there's a report that tells us the status of the epidemic-prone diseases. And for the time being, the focus has been on Lassa fever, meningitis, yellow fever. We also get information from the polio-like conditions, which is called acute flaccid paralysis. We also routinely provide information on Lassa fever as well, and like we said, Ebola as well. So it's focused, those weekly reports are focused on what we call the epidemic-prone diseases. There is, however, a national system called the IDSR, which is the Integrated Disease Surveillance and Response System, which focuses and does surveillance for a total of about 40 conditions. We recently added monkeypox to these conditions. And at the facility level, there are certain case definitions that are available to, in a very simple manner, to healthcare workers at all levels, even down to the primary healthcare, so that if they notice any of these conditions, that any case that meets those case definitions, they report it all the way to the top. And if there's an upsurge in the numbers of such reported cases, we tend to now go out and do investigation at those various levels. And so on a weekly basis, in summary, you will get, there's a report on the NCDC website.
Health security is something that, that the Nigerian government is taking very seriously. Thank you very much, Dr. Agogo. It's reassuring to hear that the risk of importation of Ebola to Nigeria is quite low, and that, your agency is working on these and other issues.